So we're going to look at the muscles of the head and neck, and we're going to start with muscles of facial expression. So there's a muscle that includes two subunits, a frontalis, and if we turn to the back, the occipitalis. And because this muscle has a tendon here that crosses the top of the skull, in recent years they've combined these two muscles into the epicranius. Now as we move toward the side of the face, then remember our zygomatic bone is the high part of your cheek here. So we have a muscle that is called the zygomaticus major that attaches to that muscle. And then we have a muscle that actually goes around the mouth, and so it's called the orbicularis oris. And then we have a combination of muscles, this muscle and this muscle, that actually elevate your lips. So they're called the levator labii superioris. And then we have a muscle that starts midline and angles laterally, which puts your lips in kind of a pouting or depresses the lower lip, which is the depressor labii inferioris. We have a muscle in the cheek that we can see here because the buccinator muscle, because the rhizoris has been cut. On the other side, we're seeing the entire buccinator because all the superficial muscles have been removed, and it compresses the cheeks as in a sucking action. There is a small muscle midline and paired muscle, one on each side of midline, that's right on the chin, which is the mentalis muscle. Now we have to change models. There's a very thin muscle that overlies all the anterior muscles of the neck. So this very thin muscle that's running over these other muscles is the platysma. The rhizoris has been cut in this model and would have continued posterior to some fascia associated with the masseter muscle. In this model, the rhizoris is still in place. So this muscle that's continuing from the lateral aspect of the lips laterally is the rhizoris muscle. The orbicularis oculi is a muscle that goes around the eye and allows you to close your eyes. We have a muscle that furrows the eyebrow, which is the corrugator supercilii, which is a deep muscle that you have to remove the frontalis to see. And the levator labii superioris, which is on your list, isn't visible, but its fibers and tendon would connect to the edge of the eyelid. Its fibers would run up like this and back into the orbit of the eye, and it elevates the eyelid. Now I'm going to go get it. So we're going to move down to the muscles that move the mandible, tongue, and pharynx. So the largest muscle that moves the mandible, allows you to shut the mandible and chewing, is the masseter, and it gets its name because the technical name for chewing is to masticate, and so we have the masseter muscle, and it's superficial. Now if we turn this over where we can see a deep muscle, then this is the temporalis, and it also attaches to the mandible and is a muscle that assists the masseter in its action. Now on the deep side, we have two muscles that come off of processes we learned on the sphenoid bone called pterygoid processes. So the lateral pterygoid is the muscle we see in this window. Its fibers run anterior posterior. And then the medial pterygoid is the muscle we're seeing here, and its fibers run superior and inferior. So these two muscles also aid in manipulating the mandible for chewing. As we move to a model which has been even cut deeper in the throat area, then we can see the muscles that actually are involved in controlling the tongue and helping stabilize the bone that we see here, which is the hyoid bone. So when we're looking at these, then this muscle that comes off the inside of the mandible, we have an elevation here called the ginium. So all of these muscles are named by origin and insertion, and they're going to actually insert on the tongue. And so a word we use for tongue is glossal. So this is the genioglossal muscle. We also have one that originates on the hyoid bone and inserts on the tongue. So we call that the hyoglossal. And we have a third one that originates on the styloid process of the temporal bone and runs to the tongue. So styloglossus. So these three muscles have different actions on the tongue. So the genioglossus protrudes the tongue as if you're sticking your tongue out. The styloglossus inverses that and retracts your tongue. And the hyoglossus depresses your tongue. So because the hyoglossus is, its origin is the hyoid bone, then we also have to have a muscle that helps stabilize the hyoid bone. So we have a muscle that comes off of the styloid process again and runs to the hyoid bone, so it's called the stylohyoid muscle. Now we have a muscle that is deep and under our tongue, so so you have to look in the floor of the mouth, and it's a complex muscle that actually has a fleshy part we can see here and a fleshy part that we can see here. And so this is called the digastric because di is a reference to two, gastric is a reference to belly, which is the fleshy part of a muscle. So this is the anterior belly of the digastric, and this is a posterior belly of the digastric. And the two muscles work to open your jaw. And so in this view, what we can see is three of the muscles we just talked about. The anterior-most one would be the styloglossus, the one behind it, the stylohyoid, and then the most posterior muscle, posterior belly of the digastric. Note it's attaching to the mastoid process, while the other two anterior ones are attaching to the styloid process. So in the neck, we have muscles that attach, whose origin is going to be down on the sternum and the clavicle, but whose insertion is on the mastoid process. And so we'll look at this one again with a complete muscular figure, but this is the sternocleidomastoid muscle. If we turn posterior, then we always have to remember on skulls that one side is superficial and the other is deep. So this is the superficial side and this is the deep side. So notice in this window right here we have fibers running at an angle, and we can see those same fibers over here running at an angle. So the muscle we're seeing in this window and the muscle we're seeing in the entirety here is the splenius capitis. Muscles that are called capitis get their name because they attach to the skull. So what we're going to do is we're going to cover the muscles that are involved in movement of the eye. So our reference point for these muscles is the light axis of the eye, which is an anterior, posterior, midline axis. So any muscle that is in line with the light axis is going to be called a rectus muscle. And we actually have four rectus muscles associated with the eye, and they're directionally defined. So the superior rectus is the uppermost muscle. On the lateral side, we would find the lateral rectus. If we remove the superior rectus, then we can see a muscle on the wall of the orbit of the eye near the nose, which would be the medial rectus. Then if we look inferior under the eye, we find a muscle that's called the inferior rectus. And those muscles all move the eye in the direction at which they are oriented because they attach to the anterior aspect of the eye. We have two muscles that run at angles to these. So as you'll recall, we use the word oblique to mean an angle. And so they are oblique muscles, and they attach to the posterior aspect of the eye. So when you rotate the posterior aspect of the eye in one direction. The pupil of the eye, or reference point, goes in an opposite direction. So this tendon belongs to the superior oblique. It passes through a cartilage ring here, and the muscle itself is sitting superior to the medial rectus muscle. And it rotates the back of the eye superior and medially, so the pupil goes inferior and laterally. If we look under the eye, there's a muscle now running at an angle which is called the inferior oblique. And because it attaches to the posterior aspect of the eye, it rotates the posterior of the eye medially and inferiorly, so the pupil is going to go superior and lateral. So we just got through talking about the sternocleidomastoid on a head, and we couldn't see the entire muscle. So here we can see the origin that's on the sternum. We can see the origin that's on the clavicle, so the first part of the name, sternocleido. And then we can see the muscle bridges the neck and attaches to the mastoid process. So hence the name sternocleidomastoid. If we look posterior, we were also talking about the splenius capitis. And on Big Bob, we can see on the superficial side, we have a muscle, the trapezius, in the way. So when that muscle's been cut, we can see an underlying muscle, which is the splenius capitis that we talked about earlier. As you recall from earlier discussions, the diaphragm is a flat muscle that separates the ventral body cavity into the thoracic cavity and the abdominal cavity. The diaphragm has its origin 360 degrees around you, including the ribs, the vertebrae posterior, and then anterior. We can actually see the diaphragm stair-stepping along the ribs to the xiphoid process. So the diaphragm's a unique muscle in that it has its origin 360 degrees around you. The insertion is the central tendon, which is this connective tissue that makes up the center part of the diaphragm. So because the fibers are running superior to inferior, then when the diaphragm contracts, it drops the central tendon drops, and that allows you to breathe in. Because we change the volume down here, we increase the pressure, so when the diaphragm relaxes, the diaphragm domes back up. The muscles that help aid the diaphragm as you move from quiet breathing to labored breathing are the muscles between the ribs. So they're called intercostal muscles between the ribs. Notice there's a relief change here and here. So they're trying to demonstrate that this is a superficial muscle, this is a deep muscle. So we have external intercostals and internal intercostals. Their role is the external intercostals spread the ribs and aid in respiration or inspiration. And then the internal intercostals bring the ribs back together and aid in expiration. So we have a number of muscles that help compress our abdomen. So when we're looking at the superficial aspect of Big Bob, the muscles that run parallel to the midline are called the rectus abdominis muscles. And then on the sides we have three muscles that are layered. The outermost one here is the external oblique. If we remove this muscle, then the next muscle we would see on this side would be the internal oblique. If we take Big Bob apart again and we look at the inside of the abdomen, now the fibers that are running on a transverse plane are the deepest of the three muscles, which is the transverse abdominis fibers.